Cindy Whitekill with Provider Magazine, and I'm here today with Dr. Cindy Badeloo, who is Vice President and Chief Operating Officer at the Iowa Healthcare Association. Cindy, thanks for joining us today.
You're welcome.
Could you share with us some insights into how the Medicaid managed care final rule is going to impact providers?
Well, in Iowa, interesting, we've had our managed care now for 6 months. And when they implemented it in Iowa, they used many of the, what was at that time proposed rules. So the key things I think are, I'm thinking of 6 things. One would be is your stakeholder engagement. They have to now involve stakeholders as in providers, even to the point that they even list that you need to every managed care organization needs to have somebody on their advisory groups from nursing homes, is to be at the table, be at those. There's going to be a lot more requirements for communications with members and with providers, so that they'll be doing listening sessions, public hearings, more committee meetings, is to be at the table at all of them. Anything you could be involved in that, I think, will help a provider set and change what might happen in the future with the managed care companies. I think the other one is working with, there's more on emphasis on coordination and continuity of care. For example, every person in a nursing home, at least in Iowa, and I think under the others with the managed care changes, they'll all have a case manager. It's figuring out how to use your case manager and your managed care company or your provider advocate that's supposed to work with you from the health plan on how you can use that case manager to better provide more services, either at a higher level, a higher acuity that you could now provide, or become the nursing home that you can provide those services outside the facilities. Is use those case managers as your voice to helping residents, but also showcase what you can do. Because what you can do is help those managed care companies, as well as they're trying to meet their members' needs through you. I think those two are key. The other one that ties into that is network adequacy. There's requirements now that the managed care plans have to show and be transparent about what their network is, and that they can provide services within so many minutes, so many miles of every Medicaid beneficiary in the state, so for all services. So as a provider, I would be looking at what is your market out there. Are you somebody who provides a specialized service? Are you the only one within 30 miles or 30 minutes or 60 miles? What do you provide to that health plan that they don't have and that can benefit their network? And I think with those new rules, there are specific requirements now, so they have to cover their entire state. So I think it's looking for opportunities. I think there's lots of opportunities in there, as well as with one of the requirements is related to rebalancing. And I think of rebalancing not only between SNF provider and HCBS, assisted living, but also the hospitals, of rebalancing not so many people in the hospital, but what you can do in post-acute. And the MCOs now will have bonuses, in a sense, built into their system so they can get more money if they rebalance the system. So the less hospitalizations they can do to nursing homes, less nursing homes they can have in home health, and you can be that provider of actually all those services. But it's showing how you rebalance. For example, one of the quality measures is discharge to community. So use your data. Data is going to be extremely important, no matter if you're in assisted living or if you're a nursing home, is showing what your data is. How are you rebalancing? What's your discharge to community rate? What's your quality measures? Because that will tie into the other one of value-based purchasing. It's going to be, in the managed care rules, it actually requires states to do value-based purchasing. And we already know they're already looking at SNFs on how they can do that, not only from the Medicare standpoint, but now the Medicaid standpoint with this. I know in Iowa, it's already a requirement that'll be in less than a year that they move 40% of Medicaid managed care to value-based purchasing. And So instead of waiting for the state to come to you, go to them. I really recommend people working through their associations. They're at the table. If not, they're going to be at the table with any of the health plans. I think those are our new partners. We have state agency partners, but now we have all these health insurance that are also going to be our partners, as our state would tell us they're the payers, and so figuring out how to work with them. And I think my biggest advice for any provider is making sure you're engaged with your association on what's going on with managed care and the changes, and be at the table. If you're interested in being on a stakeholder advisory boards that the insurance companies are running, let your association know, so that you're there, because this is, I think, our opportunity to influence the rules as they're coming out and trying to be implemented. A very short answer to a long answer to a short question.
Well, thank you. That was some great